Today, Pfizer is committing to offer all of their prescription medications to Medicaid, and it will be at the most favored nation's prices. It's going to have a huge impact on bringing Medicaid costs down like nothing else. I told you that in my first term, I was so proud of the fact that for the first time in 28 years, drug prices came down. And I had a news conference that I explained it was 0.1%, but it was down. And here we're talking about, in one case, over 1,000%. This is a critical step forward to our work and to improve health care and hardworking, low-income Americans.
So earlier this week, Donald Trump made that statement, and some people are saying, is this socialized health care? It's not the way I read it, and I want to talk to Dr. Oz about that, but I also want to talk to him about the shutdown because people don't really understand why the government is shut down, and it all centers around Medicare and paying for illegals who should not be here in the first place. There's a lot to this. Dr. Oz is with us now. Hi, Doctor. How are you?
Hey, Glenn. Let's tackle that second issue first because it is much on mine. So I'm here in the Capitol. I'm literally looking at the Capitol building right now, and senators are in there trying to figure out what to do. But it is really reprehensible what the Democrats are doing. This has been a process, this continuing resolution process, whether you like it or not, that's gone on for a long time. It happened in March. There's nothing to discuss here. We have a lot of things we can fix in America. One of the things we addressed, I think, quite successfully is the fraud, waste, and abuse in Medicaid. In fact, some of the points you make, like money going towards illegal immigrants, that, again, it's not that you're paying for it in California. It's that folks are being taxed in Mississippi and Texas and Florida, and that money is being shipped to California. We stopped that. We're not going to reverse that, and we're certainly not going to reverse it for 7 weeks of continuation so we can actually have more negotiations. And there's a lot of other things that play in here, but I'm the one who's supposed to be taking care of Medicare, Medicaid, the exchanges. These programs can get hurt if you shut down the government. We've got to make sure we have telehealth that works. We've got to make sure there's you can be hospitalized at home if you're really sick as opposed to in the hospital, which is very effective in many situations. These programs we struggle to keep open when you have a shutdown of this nature. This is high stakes poker and it's unfair. And frankly, the Democrats don't have many chits anyway. So I think they ought to get past this, swallow their pride. This was a mistake, and let's go forward and fix some of the other issues that might be worth discussing.
So I saw a doctor write an op-ed and he said, look, I'm working the emergency room and somebody comes in and they've got a gunshot. And what am I supposed to do? Ask if they're here legally? No, that's not what we're talking about, is it?
No, not at all. If you go to the emergency room, then we have a law in TALA that will protect you. You will get the care you need, especially if it's life-saving care. You're in trouble if you don't provide that care. So this is not about that at all. This is about giving benefits to illegal immigrants. Again, I'll pick on California because it's such an obvious case. Tens of millions of dollars of vision, dental. I mean, if you're on Medicare, you don't get dental. If you're on Medicaid in California and you're an illegal immigrant, you are getting free dental care. I mean, it's just not fair to the American people. Again, it's not like the citizens of California are paying for that. We're footing most of the bill at the federal government, which is we tax every one of the other 49 states. And then we pay California to make up for the fact that they've decided to fund illegal immigrant health care. And guess what happened, Glenn? When we put our foot down and said, we're done, we're not going to do this anymore. After all the whining and complaining about how bad and reprehensible Republicans are in Washington, guess what Gavin Newsom did? He shut down exactly the programs we'd said that needed to be shut down. He wasn't going to pay for it either. They're fine being nice about these things and, above reproach when it's not their money. But if you're spending your own money, all of a sudden they start to act like Republicans.
And this is something that was in the big, beautiful bill. This is something that was passed by Congress to stop this. This isn't new. That we already discussed it. It already passed. It's a law. And now in this negotiation period, they want to say, oh, you've got to repeal that part of the law. Correct?
Correct, Glenn. And but the part that I don't think the Democratic leadership understands is we saved Medicaid. I'm sitting here in the Hubert Humphrey building, and there's a great quote he has in the opening, the archway. It says, it's the moral responsibility of government to take care of those who are at the dawn of life, the children. 53% of kids are born into Medicaid or CHIP. Those in the twilight of life, the elderly, those are folks who are older and don't have resources. They're really in trouble if we don't help them. And then those who are living in the shadows. And Glenn, that haunting metaphor of light, I think about every day. That's who Medicaid was designed for. I am not going to let the program implode under the weight of able-bodied individuals who were never designed to be on Medicaid.
Right.
So we fixed that. We also fixed the money laundering, the legal, but still money laundering in terms of its effect that states were doing to take advantage of the federal government. Now everyone can chip in fairly as the system was originally designed.
Can you go into that? Because I saw a press conference, I think it was last week. I think I was in Phoenix last week, and I saw a press conference where the FBI had done the biggest sting operation in Medicare history, and it was stunning how much money was being stolen, even by foreign governments that were being involved. Do you have any of that you could recall?
Well, we were, I actually was at the press conference. It was me, the Office of Inspector General, this FBI, and the Department of Justice, and we busted a $15 billion multinational criminal syndicate. I'll share with you that it's primarily Russia-based. The perpetrators fled to Russia, which is why we think that's the case. Now, my job is to make sure the money never leaves the building. So although it's a $15 billion effort, they only stole $2.9 billion. Think about that. Only $2.9 billion. It's a lot of money. But they didn't get all 15 billion. But we have a massive target on our side. My agency, CMS, distributes about $1.7 trillion to the American people for Medicare and Medicaid. Again, our most vulnerable depend on this program. Foreign governments can take a beneficiary number of a Medicaid or Medicare patient and pierce us and start stealing and sucking like ticks money out of the system. So we need to stop that. And I've spoken to Attorney General Bondi. Actually, Treasury's helping us, Scott Bessent, because there's banking reform we need, because these folks are also laundering money. But Glenn, they're taking tens of billions of dollars away from American taxpayers. We have not realized how massive this criminal conspiracy is. And these are not small-time players. These are big multinational efforts.
It was one of the most stunning press conferences I had ever heard. I listened to it. And I was in the car by myself, and I'm like, oh my gosh, oh my gosh. It was stunning. And it ended with, and this is just the beginning. Is there much more of this?
This is the tip of the iceberg, Glenn. It would get you and the listeners, viewers so angry if they understood the scale of this problem. We have more durable medical equipment suppliers, knee braces, back braces, wheelchairs. We have more of those folks in South Florida than McDonald's, I am told. And we think the Cuban government's helping them. We know the Chinese are involved. There's in hospice fraud in California. We have many, many programs that can boast survival rates of 5 years or longer for their average customer. You're in hospice. By definition, you're supposed to be living your last few weeks to months of life, and yet everyone seems to live 5 years in these programs. Why? Because they're not really terminal. These folks are being they're being lied to or they're being pulled into the system. And these are the kinds of endeavors we are aggressively pursuing. We have a whole fraud, waste, and abuse war room. The president passionately wants us to break down the silos. So we're working with Treasury and DOJ, FBI, all of us collaborating together in order to shut this down. These are bad people, and they will cheat us at every level. But again, they are being supported by foreign governments.